Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. All right, so today we are talking about omega-3s and omega-6s. We're going to talk about doing some testing to see where our omega levels are at, and then we will discuss a little bit about the influences of omegas and fats in general on performance, health, and the rehab process. Okay, so first thing we should really understand about omega-3s is that they are an essential fatty acid. What this means is our body cannot manipulate other compounds in our body to create this sequence of fatty acids that would mimic an omega-3 like EPA or DHA. So we have to actually ingest this and take these in through our diet. And again, most common sources that have high enough sources to actually be useful for us would be things like fatty fishes, right? Different types of tuna, salmon, crab, other kind of seafood sources like that. And then there are some other sources like different types of nuts, but again, these are still so minimal in how much fatty acids they have. It's worth investing in and looking into and including in your diet for this reason. But again, if we're not having any of these heavy hitters in there, then we may very well be falling short on our omega-3s. Now, we can get omega-6s from a few other sources that it makes it quite easy to get high amounts of omega-6s. Now, if we're going to compare the two, omega-3 and omega-6, it's important to know omega-3s kind of associated more with increasing better cholesterol, right? The good cholesterol in our body, while omega-6s may be more associated with creating inflammation. Again, it's an essential fatty acid, so we do need to get omega-6s, and they are important and useful, especially for performance athletes. But again, we're going to talk a little bit later about the ratio of omega-3 to omega-6, where we are getting lots of omega-6s in a typical, you'd say, American kind of standard diet, and very minimal omega-3s. And then where things go a little bit wonky is our omega-6s tend to be so much higher in quantity than our omega-3s that it is theorized that this is kind of a source of a lot of issues for people, right? So again, omega-3s, they do a lot of good work, and omega-6s, essential and important, but in too high quantities, especially when our omega-3 to omega-6 ratio is off, very well could be leading to that increased high levels of inflammation that we see in a lot of people, and could be a cause for a lot of the different diseases and issues that we see. So let's dive a little bit more into the role of omega-3s in the human body, just for health and as well as performance. So just to keep it brief, omega-3s in terms of health, think anti-inflammatory, right, or inflammation regulation. They are, again, essential in a lot of processes in the body, like hormone production, things like testosterone. They're essential in the cell membranes, right, which is actually a place we go to look to test for omega-3 quantity. But again, hormone production, cell membranes, and inflammation regulation, right? We need to have omega-3 fatty acids with that type and quality of fatty acid in our bloodstream that these things can take place, right, as well as many more. Without it, we lose the ability to produce vital things like hormones as well as cell membranes, and we lose the ability to kind of regulate our inflammation. And omega-6s, again, on the other hand, tend to upregulate inflammation, right? They kind of push it in that direction. So if we don't have omega-3s, we can't regulate that inflammation. And even if we do have omega-3s, if our omega-3 to omega-6 ratio is off, then we are kind of losing that battle of inflammation there. Now, there is some evidence regarding omega-3 supplementation for performance. So things that they looked at was power output and strength. But again, the data here not exactly clear on whether or not omega-3s are unequivocally useful and beneficial for creating power and strength gains in athletes. Now, there is proposed mechanisms in place here and kind of a theoretical base that makes sense. That they could push muscle protein synthesis and power output, but again, the real benefits are really more pointed towards endurance activity, right? And again, this makes sense where endurance activity we are more tapping into our fat oxidation as a form of energy. So again, if we have more omega-3s in there, then we can improve that fat oxidation pathway, right? And the body has plenty of fuel and is able to regulate that use of omega-3s and other fats for energy. Further, if we talk about recovery, there is a little bit better evidence here that says that supplementation with omega-3s is quite actually beneficial, right? So this kind of helps create a hierarchy where we're putting omega-3s a little bit higher on that hierarchy due to its ability to help us in recovery stages after training, injury, or illness. Again, they've seen improvements in the integrity of muscle cell membranes, right, after exercise, and this could help reduce soreness, so that DOMS, that delayed onset muscle soreness. If we are able to reduce that DOMS, then we can train earlier, we can train harder, and we will be less affected by our previous training sessions, right? So helping in that recovery, reducing muscle damage. And again, oxidative stress that comes from exercise and training, having omega-3s and adequate supply in the body can reduce the oxidative stress, right? It can help in the process of containing the free radicals that are created in the process of training and exercising. Now, last, we can look towards omega-3s in the event of acute injury and illness, right? So something like a concussion or any sort of acute injury like an ankle sprain, things like that, where we are, again, regulating that inflammatory stage, which is really important here. We need it in order to get rid of damaged tissue and then start the process of healing and building back, right? So inflammation is important, but again, regulating that could be vital in not overreacting to an injury, right? Not letting the body create more damage than is needed, and we can kind of jumpstart that recovery process a little bit quicker, again, if we have adequate stores, adequate supply of omega-3s in the body, right? So for acute injury, we can, again, look towards supplementation in omega-3s, and again, there's pretty good evidence for this as well. Okay, here is an example report from a test we like to do with some of my clients and patients, where we are looking at omega-3 content, right? So this is just a simple finger prick where we get just a drop of blood, we put it on the sample, we send it in, and then they send back this report, and this gives us great data and information on your omega-3 content and where things have kind of been in the last couple of months. So this omega-3 index looks at, in one single cell membrane, we have different types of fatty acids in there. And the more omega-3s that we have in there means the better omega-3 content or intake we've been having relative to our other fatty acids, right? And so as you can see from here, we want that range to be between 8 to 12%, right? Now, you can think of this as like a A1C, where the more omega-3s we've been ingesting over the last bit of time relative to the other fatty acids we've been having, then the higher that index will be, okay? Kind of opposite of an A1C, where the more simple carbohydrates or sugar foods we've been eating, kind of the more blood sugar or the higher blood sugar state we've been in over the last 3 to 4 months will raise your A1C, which we don't want to see. In this case, we want to see this index number go up. Okay, but again, it gives a snapshot of where have you been, how you've been doing with your index and relative fatty acid intake, right? So really important first number to kind of look at. Now, again, we want to see between 8 to 12%. If we don't, then we know that we either need to reduce the fatty acid, other type of fatty acid intake, or increase your omega-3 intake. Oftentimes, it's the latter. We want to see your omega-3 intake go up. If people aren't supplementing with omega-3s, or they're not looking directly at increasing their omega-3s through their diet, then they tend to be pretty low on the intake of EPA and DHA, the important omega-3s that we look for. Okay. Now, otherwise, this report also has a omega-3 to omega-6 and different fatty acid profiles here, right? So omega-6 to omega-3 ratio, we had mentioned this a little bit before. Oftentimes, we are getting a lot of omega-6s in and very few omega-3s. If that's the case, our omega-6 to omega-3 intake will kind of be off the charts here, right? So we can see it goes up to 11.1, where we're getting for every 1 omega-3 kind of fatty acid we're getting in 11 omega-6s, right? That's kind of on the higher end, the bad end there. What we're looking for is 3 to 1 to a 5 to 1 ratio, right? We're always going to get a little bit more omega-6s in than omega-3s, and that's okay, right? We have a desirable range there. So again, another really important test to look at. What is our ratio looking at specifically between omega-6s to omega-3s, right? And that's something we really want to dial in once we get this data back. More specifically, we have this AA to EPA ratio, right? So this is that arachidonic acid compared to the EPA, right? The eicosapentaenoic acid, kind of a mouthful there. So the EPA, a type of omega-3 that we very much would like to get in high quantities, compared to this AA, which is less desirable, right? It has uses, of course, but we want to make sure that we are keeping these things in check. Okay, so you can see this one will go all the way up even to 32 to 1. But the desirable range, again, 2.5 to 1 to 11 to 1. Okay, and if we can stay in that range, then we're happy. This, again, tells us where are we at with our diet, where have we been, and how are things starting to flesh out in the actual cell membranes and in the blood, right? What are we seeing make it to the blood and make it to the cell membranes? So, again, data that we can look at. So when we are supplementing or changing up our diet, we can have numbers to shoot for and compare to. Why is this all important? Well, overall health, like we had mentioned before, maintaining important processes in the body and structures in the body, as well as heart health, cardiovascular health in general, right? Important. If we can lock these in, we do a lot of great things for our percentile, our likelihood of having like a cardiac event or stroke, and other types of cardiovascular disease. If we can put these back into that green range. Performance, we can recover better, we can recover from acute injury better, and there may even be some direct performance output improvements as well. And again, the data is still coming out on that. Now, the last thing we can look at is this trans fat intake, this index here. Now, I think most people should be doing a little bit better with this. If your diet's really out of whack, then we can see some issues here. But anyone who is cognizant of their diet should be doing pretty well in this trans fat index. Now that trans fat's kind of been outlawed and banned across the world, really. We don't get them in our foods too much, but if you are still eating a lot of processed and baked goods and things like that, then you can still find a little bit amounts of trans fat here and there, which again can add up over time and overall to increase this trans fat index. Now, again, trans fats, why are they so bad? They increase your bad cholesterol, they decrease your good cholesterol, right? That's kind of what the data's been showing. So there's just nothing good about these. They are helpful in zero ways. So when we get a lot of these in, it just wreaks havoc on the cardiovascular system there, okay? So just one last test to just double check, make sure everything is looking good with the trans fat index. Just want to make sure we're keeping that low, right, in that desirable range. Okay, so you can find a link to a research article which touched on a few of these points that we talked about today. I will include that in the description. But otherwise, you can see the importance of looking at checking omega-3s. They have general just health implications, longevity implications, some performance implications, and definitely some recovery, which again will translate later into performance. So we want to look at this. Oftentimes we'll recommend supplementing with about 2,000 milligrams of DHA and EPA, so mostly, hopefully, majority of that is EPA, and that should do the trick. Otherwise, you just have to check your sources of omega-3s from what you're eating, and again, try to get up towards that 2,000 milligram mark where it'll make us a little bit happier. Again, we try to stay away from supplements if we don't need them. Whole diet is the best way to get any change in in numbers, including omega-3s and omega-6s. But this is one where supplementation definitely will start to become a good option for a lot of people, especially as they start to work into eating more omega-3s and things like that. And even still, a lot of people will, even if they're eating a good diet and trying to get good sources of omega-3s in, will still supplement with this, and that is not a problem. So definitely something we start to look for. And it is definitely part of my rehab and my performance packages in terms of the supplementation that I offer. So thank you for listening in today. This was an important discussion on fatty acids, omega-3s. Again, there is general health implications here, but there is a rehab side to it, right? Where when we get people in with either acute injuries or chronic, like low back pain, neck pain, elbow, shoulder, whatever it is chronic issues that we're working through. supplementing and getting in more omega-3s is always on the list. And then again, for the performance side of people, this is something that we look towards as well to help guide us and improve things and get things going in the right direction. So thanks for listening today. We'll get another podcast out next week. That's all. That's it for today. Thanks. Bye.